Hey guys, Dr. Ray here, Back Pain Relief Center, and we're here with one of our great patients, Mr. Booney. And the reason why I wanted to film adjusting him today is because when we first met, he brought in a stack of MRIs, right? You had to have a ton of them.
Oh yeah.
He's been to pain management, he's been to orthopedics, he's been all over the place. He came in with his whole folder worth of reports and all that because he's suffering from cervical, thoracic, lumbar pain. So basically, from here to here hurts. Pain down his leg, pain in the arms, and no one was giving him right answers. And I think with some patients, they get mismanaged, right? They kind of forget you, they kind of sweep you under the rug a little bit. Once they feel like they can't help you, the only thing they can do is get medication and maybe send you a PT, but you're not getting good answers. And we've been doing a series of spinal manipulations on it, a little therapy, and it hasn't been improving for you?
Yes.
It's been getting much better. And you know, he was one of the cases when I looked at his stuff, I almost didn't think I could help you. I thought I was going to have to refer him to someone else. And now we're here. He's probably one of my best patients as far as responding to the care. He comes when he's supposed to, and we're feeling better now. All right, so let's go face down for me. So Mr. Booney, unlike some other patients, has problems everywhere. So we got herniations all in this area, and it just goes to show you that spinal manipulation and decompressing the joint, loosening the muscles up, does wonders for your back. It really can help you manage your pain. So the first thing we're going to do, I'm going to use an instrument, and what I do is just kind of vibrate each one of the spinal joints, and what it's doing is breaking up any adhesions or scar tissue that might be restricting that joint. Just kind of loosening it up, and you know, I'm kind of cheating a little bit as a chiropractor because using this instrument makes it easier for me to adjust or manipulate the spine. Okay, next we're going to check his leg length to see if his pelvis has rotated at all. And we got a short leg there on the right. I'm going to use a drop table. This allows me to use a lighter pressure to realign the pelvis and the lumbar spine. Check again, and that helps. All right, next thing we're going to do is a lumbar spinal manipulation. So lay your side for me, face me. I'm going to bend that top leg. And then we're going to get there. We're just going to realign this. Good, nice and easy. Other side. See?
Not ringing, it's just me.
Okay, we're going to bend that top leg bottom one straight. That'll lean you back a little bit. Good. On your back, let me face up. So again, Mr. Booney is a unique case in that he's got a bunch of degeneration in his cervical spine or in his neck, but the manipulation does help decompress it. It's not for everyone. Probably half my patients love it, half hate it, but he responds pretty well to it. Good one. Come on up. Yeah. We're going to sit on the edge here. So the last adjustment, we're going to adjust through this thoracic spine. That upper back has a lot to do with your neck. You can translate into the low back a little bit. If this gets locked up, none of this stuff works. One there, chin down to your chest. I'm going to lay you back. Where's it going to squeeze you? Good. One more. Good. One more up here. Good.
Great.
Good adjustment.
Yeah.
He responds really well to it. I'm glad we can help you. What we're going to do next, we're going to do some roll a bit to help loosen his body up a little more. All right, guys, thanks for watching. Thanks for being a patient and letting us do that.
Thank you.
We'll see you guys next time. Bye-bye.